Thyroid surgery can have a significant effect on voice. This really relates to the anatomy of the thyroid gland and the larynx, which the thyroid gland is wrapped around. The nerve to the vocal cords innervate the vocal cords and allow the vocal cords in the larynx to move inward to speak and outward to breathe. These nerves are right behind the thyroid gland, and so they can be commonly affected during thyroid surgery. If the nerve is injured on one side, it can reduce the electrical activity that goes to the vocal cord, and so the vocal cord, instead of moving, stays stable in its position. This results in two symptoms. The first is a weakness to the patient's voice, not so much a complete loss, but a unplugging of the power of the voice. And also it affects patients' swallowing, especially liquids, and makes them cough when they drink liquids. These two symptoms occur to a varying degree with nerve injury, but they do occur to some extent with nerve injury. The rate of nerve injury really varies with many different parameters: the size of the thyroid gland, the presence of cancer, other issues relating to the surgical experience of the surgeon. So many thyroid gland and surgical parameters relate to the risk of nerve paralysis. Overall, the rate of nerve paralysis can be as high as 10% in some studies, and so the patient really needs to speak with their surgeons before surgery about the surgical experience that the surgeon has and how many of these types of surgeries the given surgeon does. In terms of ways that we can avoid this nerve being injured during thyroid surgery, I would say there are two factors. The first is it's important to go to a more experienced thyroid surgeon. They have typically rates of paralysis that are lower, and it's important then for the patient to discuss that with the surgeon beforehand to get a sense of how many of these surgeries that particular surgeon does. Also, there is a technology that is applied to thyroid surgery called intraoperative neural monitoring, where equipment present during surgery allows the surgeon to get electrical information regarding the health of that nerve to the voice box, the recurrent laryngeal nerve, during surgery. While not all surgeons utilize this technology, I do personally believe that it helps inform the surgeon about the health of the nerve during surgery, helps them localize it, and I think helps them preserve it. And so that's another item that the patient can discuss with their surgeon before surgery.